How is blood pressure checked? In these days of automatic blood pressure monitoring in intensive care units and operating room, you may not need to know how to record blood pressure. Still, knowing the basic principles are always nice. The technical name of the device used to measure blood pressure is sphygmomanometer, but this name is seldom used and often it is called a BP apparatus. The older generation mercury BP apparatus is now obsolete, being replaced by an aneroid equipment almost universally. Blood pressure is measured by inflating a cuff on the limb on which it is to be measured. BP measured in the thighs is usually higher than in the arm. BP can also be measured at the wrist. The pressure in the blood vessels carrying oxygenated blood, known as arteries, is the one which is usually measured. The higher value obtained when the heart contracts and pumps out blood is called systolic blood pressure. The lower value when heart relaxes is called diastolic blood pressure. The inflatable blood pressure cuff is usually placed over the arm above the elbow. Pressure in the cuff is raised using the bellows till the pulse felt at the wrist disappears. This gives an estimate of the systolic BP. The chest piece of the stethoscope is then placed over the inner part of the elbow below the BP cuff. The cuff is inflated again till the pressure in the cuff is well above the previously noted systolic pressure. Then the cuff is deflated slowly, listening to sounds over the elbow. The sounds are heard when the cuff pressure falls below the systolic pressure and disappears when the pressure is below the diastolic pressure. Both these levels are noted. The same effect is observed in the manometer needle when the pressure falls below the systolic pressure. It starts oscillating slightly and the oscillations stop when the cuff pressure falls below the diastolic pressure. This is known as oscillometric method of measurement of blood pressure. This oscillation of pressure within the cuff is used by automatic blood pressure measurement equipments using pressure sensors. Care should be taken to avoid too tight or too loose application of the cuff. The person should be resting comfortably for some time before the measurement. Average of multiple readings give a better assessment. High blood pressure is known as hypertension and low blood pressure as hypotension. Anxiety during measurement can raise the blood pressure and is called white coat hypertension. Home recordings or ambulatory BP monitoring are useful to identify this. A bigger cuff is required in obese persons to fully cover the arm. Cuff needed for measuring blood pressure in the thighs is also larger. Children need smaller cuffs according to body size. Typical normal blood pressure in an adult is 120 by 80 millimeters of mercury. It is lower in children and increases gradually as they become adults. Please don't forget to subscribe to this channel for future updates and click on the bell icon for all updates. Thank you.